I got my big hair for a big topic, RSV. It's RSV Awareness Month. We are doing a big series. We're talking about everything you need to know about RSV and a little thing called synergies, which you're going to hear a lot about if you're in a preemie circle. Today we're going to start the series off simply by talking about what is RSV, how RSV spreads, the symptoms, how to prevent it, and why preemie parents should really know about it in under 10 minutes. Wish me luck. What it is. RSV is actually a common virus that most kids will get. For those who are not high risk, RSV typically plays out like a common cold, and it clears up between 10 to 14 days. But for those who are considered high risk, they can get severe RSV, and that leads to serious complications, lung infections that can include swelling of the lower airways of the lungs, pneumonia, respiratory failure. It's very, very, very serious. A lot of people are like, well, what's the big fuss? Like, why are we dedicating a whole month to this? RSV, when it becomes serious, is serious. It causes 90,000 hospitalizations and about 4,000 deaths a year. And that's 4,000 deaths a year for children 5 years of age or younger. So, big topic, big deal. How does it spread? RSV spreads like a common cold through droplets in the air from touching a contaminated surface. The virus can survive for up to an hour on hands or clothing and for several hours on non-porous surfaces. Those are things like toys, countertops, doorknobs, things like that. So, for example, you could pick up RSV when an infected person coughs or sneezes in your area, or if you touch a surface that's been contaminated, or for instance, like a kid touches a toy, and then you put your fingers in or near your mouth or your nose or your eyes. Is RSV contagious? Yes, yes, and yes. It's usually contagious for about 3 to 8 days. However, some folks with compromised immune systems, they can be contagious for weeks. When is RSV season? Well, it typically starts in the fall, so around October, November, and then ends in the spring. However, it really does depend on where you live, because there have been some cases where they've seen year-round instances of RSV, which is yikes. What are the symptoms? Well, there's a whole lot. We're going to break it down. Episodes where the breathing stops for about 15 to 20 seconds, a caved-in chest, flaring nostrils when breathing, coughing or wheezing that doesn't seem to stop, difficulty breathing, fever, runny or stuffy nose, a sore throat, bluish color around the mouth or the fingernails, an earache, a reduced appetite, irritability or not sleeping well, being lethargic. Is there a cure? And what's the treatment? There's no cure, and in most cases, RSV, it'll go away on its own in about 10 to 14 days. In severe cases, medicine and hospitalization will follow, and those treatments will depend on the case and needs of the child. Why should preemie parents be concerned? If you have a kid that's in NICU or has graduated NICU, you should be vigilant because your kiddos are considered high risk. High risk situations include those in daycare or living with siblings who attend school or daycare, those who are born premature, have certain types of chronic lung disease, was born with certain types of heart disease, infants and children younger than 2 years of age at the start of RSV season, babies with lung development and function issues, basically anybody with a compromised immune system. So how do you avoid RSV? It's the big question. You avoid RSV the same way you would avoid kind of a cold or a flu. Cover your coughs and sneezes, wash your hands with soap and water often for at least 20 seconds, making sure small children do the same, keeping your hands off your face, avoiding close contact with those who are sick or sharing cups, eating utensils with those who have been sick or you suspect might be sick, cleaning and disinfecting surfaces that are commonly frequently touched by various people, doorknobs, handles, things like that. Other methods that preemie parents include, and I've heard and I've seen, is avoiding crowded areas or wearing a face mask out in crowded areas. When you're out in crowded areas, the minute you come home, changing your clothing. Again, those droplets and things can land on your clothes, and your clothes become kind of carriers for RSV. removing your shoes when you enter your home, grouping your outings all together. So when you come home, some people just they actually take a shower and a bath, things like that. So that's the lowdown on RSV. I'm going to be covering a whole bunch of stuff this month. We're going to talk about Synagis in its own video, give you an impartial pro and con to Synagis so that you and your family can make the right decision when it comes time to make that decision if you happen to be nearing discharge or your kid falls in the group that qualifies for Synagis. You're going to hear a whole lot about Synagis if you're a preemie parent. What we did our first go-round of RSV season, my twins were actually discharged right when RSV season was getting ready to hit. So we had a unique challenge. We want to talk about that and what we're doing this season, given the unique set of circumstances we're encountering this RSV season. So make sure to stay tuned.